Good morning, everyone. Welcome to the Joint Boards of Health and Hospitals meeting for Thursday, March 4th. And thank you all for attending. So I'm officially calling the meeting to order, and I would like to approve, get a motion to approve the minutes of the Zoom video from February 18th, 2021. May I have a motion to approve, please?
Move. Second.
Thank you. So the Zoom video from the last meeting is approved. And we will start right in on our first agenda item, which is a COVID-19 update, including data testing and vaccine distribution by Dr. Eccles.
Good morning, everyone. As you all may know, the trends are moving in the right direction. So our trajectory right now is looking really good. However, we are still mindful of the fact that there are other variants that are circulating. A couple have been detected in the St. Louis metropolitan area. And so we're continuing to monitor that situation to see what impact that's going to have on transmission, not only in the city of St. Louis, but across the St. Louis region. Specifically in the city of St. Louis, our 7-day average for COVID-19 cases is now 17, and we've been under our goal of 35 cases per day for 7 days. The percent positivity rate in the city of St. Louis is now 4%, and we've been at or below our goal of 5% for also 7 days. The average total hospitalizations among the St. Louis Metropolitan Pandemic Task Force hospitals is now 304. And this is another metric that we've been at or below for the last 7 days. The other metric, which is a new hospitalization, is still trending in the right direction, but now we're averaging 40 new hospitalizations within the St. Louis Metropolitan Pandemic Task Force hospitals, and we've been meeting that metric for the last 3 days. Our trajectory is also looking good. We've had a negative 11% or 11% reduction in newly confirmed COVID-19 cases in the city of St. Louis. The percent positivity is also reduced by 1%. So although things are moving in the right direction, we're not taking our pedal off the gas, off the brakes yet, because there's still other variants that are circulating in other parts of the country and the world, and eventually those variants will become present in our area. And so we're very mindful of the impact that may have on the spread of SARS-CoV-2. Along those lines,
Fred, can I interrupt you real quick?
Yes.
Do you know which particular variants were discovered here?
The UK variant has been discovered, and then additional testing is being done by the state to see if the other variants are present in the area as well.
Okay, thanks.
So we're communicating closely and regularly with the Missouri Department of Health and Senior Services to make sure that we're aware of what other strains are detected when they're detected in the state of Missouri, and specifically in the St. Louis metro area. As it relates to vaccine distribution, as we all know, there's been a lot of challenges with vaccine distribution. Initially, it was receiving vaccine, and then it was actually getting vaccine out. And so we've been holding, the City of St. Louis Department of Health, in collaboration with a lot of our partners, have been holding mass vaccination clinics for the last couple of months. The first one was held on January 22nd. And so we continue those efforts, and we're using a data-driven approach to make sure that we're getting vaccine to the right communities. The first community-based vaccination event was held the other Saturday in North City. We held it at the Omega Center, which is at 3900 Goodfellow. We have our second community-based mass vaccination event scheduled for this Saturday, March 6th, and this will be held in South City. The goal for this Saturday is to vaccinate over 2,000 individuals for COVID-19. We are, again, using a data-driven approach. We're also using our database that has been created from individuals who have registered, indicating that they want to receive the vaccine. And so we're pulling from that list. We're also working with other providers. There's significant numbers of individuals within previously approved groups. For example, Group 1A, which includes healthcare workers and patient-facing healthcare workers, long-term care facility staff and other individuals who have not received it yet. And so we're working with some of those agencies to get them on our list so they can receive the vaccine. We also continue to prioritize those individuals who are 65 and older and individuals who have underlying medical conditions. Last week, we were informed by the governor that on March 15th, the state will be moving to vaccinate group phase 1B tier 3, which includes education staff along with a lot of other groups. And so, but we have to make sure we're maintaining our priority to make sure those individuals who are most vulnerable and those who have the highest risk of not only exposure to SARS-CoV-2, but those who have the highest risk of severe complications related to COVID-19 have access to the COVID-19 vaccine, as those are the populations that will have the most dire outcomes if they are infected. And so we continue to prioritize individuals based on their risk and their and how their communities have been affected using a data-driven approach. To date, the City of St. Louis Department of Health and its many partners, we've vaccinated over 11,000 individuals, and we'll continue our efforts again, continuing to hold the mass vaccination events to make sure that we're providing opportunities for as many people as possible. But again, also moving outside of the downtown area and going into communities is going to be extremely important, because we want to make sure that we're removing as many barriers as possible to make so individuals can not only access it, but individuals can access this very critical intervention, but also to make sure that we are not creating additional barriers for them. We continue to partner with other agencies such as the Department of Human Services and the St. Louis Agency on Aging to make sure those individuals who are most vulnerable, one of the populations, the homebound population, individuals who need transportation to and from their to the vaccination clinics have access. So we'll continue to work with them moving forward to make sure that, again, we are providing opportunities for everyone, especially those who are most vulnerable, so that they can have access to this critical intervention. I also want to give a huge note of thanks to the Emergency Preparedness Program. Many of you may know that at the beginning of my tenure at the Health Department, the Emergency Preparedness Program consisted of one staff. And as you all know, that wasn't sufficient for to meet the needs of the community. And so one of my priorities at the beginning was to establish the Emergency Preparedness Program. And we have an amazing Emergency Preparedness Program that have been lifting a lot of the work. They've been doing a lot of the planning for our mass vaccination events and coordinating with sites across the city to conduct site surveys, to identify other areas or other venues that may be appropriate for mass vaccination clinics. So Justin Hauser, Kelsey Spar, and Scott Geary have done an amazing job of helping us lift this critical work, and especially in the planning area for these mass vaccination clinics. So I want to give a huge note of thanks to them, as well as our many partners who have come to the forefront and helped us lift the work, particularly during the mass vaccination clinics. St. Louis University School of Nursing, along with their medical staff, Western University School of Nursing, as well as our Medical Reserve Corps and the SNMA chapters of St. Louis University and Washington University, as well as other students within those institutions, have done an amazing job of coming and providing the needed support during these events. And so we couldn't have done this work without them. And so we're really grateful for the fruitful partnerships that we have maintained and nurtured over the last few months.
Can I ask a question, or do you want to wait?
Go ahead, Dr. McBride.
Oh, thank you, Dr. Eccles, for that report and your hard work on getting vaccinations out, shots in the arms as we speak. As you know, I've been pretty vocal and frustrated about the distribution of vaccines, not based on your efforts or your team's efforts, but at the state level in particular. I don't think the distribution has been fair or equitable, and I think it's had implications for justice, social justice. And so, I think looking backwards, it's pretty well known now from all the articles that have been written that this doesn't seem to have been a fair or equitable distribution. And there have been some problems with this. And I think that's pretty well documented now. We don't need to probably retread that. But my question to you is, are we now getting something close to a fair or equitable distribution of vaccinations to St. Louis City? In your estimation, are we getting close to what we need?
So I've been a little bit creative in getting additional vaccine to the city of St. Louis. The state has increased the allocation to the St. Louis metropolitan area, giving the area roughly 30% of the state's allocation, which reflects the population size. With the city of St. Louis, we started receiving regular shipments of Moderna vaccine, so 900 doses weekly, but that still wasn't sufficient. So what we've been doing, as well as working with members of the Missouri Center for Public Health Excellence, and so some of the other jurisdictions that aren't able to utilize their allocation of vaccine, they're reaching out to me and say, can you use additional doses? And so we're saying yes. And so we've started receiving those additional allocations through those partnerships. And so I'm grateful for the other local public health agency directors who are mindful of the inequitable distribution that had been the issue before. And so we're receiving more vaccine. We're receiving a steady supply, but then that's only part of the issue, right? So getting the vaccine is one thing, but then also making sure we have plans in place and venues in place so that we can get the vaccines in arms during mass vaccination events. So it's an ongoing effort. We have received an increase in our allocation. But again, our goal is also to make sure that we're able to get as many doses in arms as possible. We haven't received Johnson & Johnson, our doses for Johnson & Johnson yet. We were informed that the state was going to issue 3,000 doses of Johnson & Johnson to the city of St. Louis. So we're just waiting for that waiting to receive that allocation. But as soon as we do, I'll make sure the board and the appropriate stakeholders are aware of that.
Thank you for your efforts.
I appreciate Tim's question, Fred. So the next issue is that we have an outstanding communication strategy and staff. We all know that they've been phenomenal. So maybe you can just talk about how are they going to be deployed to really address some of the misinformation and disinformation about vaccine distribution, particularly in the vulnerable communities on the North Side and North County.
All right, so that's a task or project that the health department can't lift alone. So we've been working closely with some of our partners who are already doing a lot of that work, such as the regional response team and other organizations, to make sure, one, we're issuing a consistent message to that community, because just make sure we're issuing a consistent statement. We also want to make sure the statement is a statement that they can understand. So we don't want to use too technical language, and we want to be mindful of health literacy levels for our community. And so we're working with them to make sure that the information is not only sound, but it can be comprehended according to the intent.
Dr. Echols, thank you so much. As someone who's been able to talk to a couple of other cities across the country, I just haven't seen as clearly laid out of a plan around equity with strong and very clear communication partners. So I echo Dr. Ross's encouragement about utilizing communication. And I just want to thank Lisa Richter and Serena Mohammed and the rest of the communications team, because we had what I believe to be a really fruitful discussion around how we can also support that work. And I'll leave that for Lisa to talk about later, because I know that's part of her plan. But I just wanted to thank you up front. I wanted to go back to the idea of variants and just ask you if there is a coordinated strategy around how, are hospitals aware in a standardized way about how they can test for those variants? Is that happening at a high degree? Because I do have a concern that we may not have a complete understanding of how those may or may not be circulating in our community.
That's an excellent question. So that question was raised in one of my conversations with the universities earlier this week. And right now, a lot of the laboratories don't have the capacity to actually screen for the other variants. And so they're having to coordinate through the state. I'm not sure about the capacity of the state to actually send those specimens to the CDC for testing. And so that's something that we're having to work through. I do know that some private laboratories in other parts of the country are starting to screen for at least the 3 of the variants that have been detected. But we need that capacity here in the city of St. Louis as well. And so my hope is that over the upcoming weeks that the private laboratories, even the academic laboratories, will be able to start screening for detecting these other variants. But to this point, a lot of the local laboratories don't have that capacity.
I think very few people in hospital settings would have an understanding of when would be appropriate for that. So I think it may be helpful to reach out to the regional task force, Dr. Garza and his team, just to see if, with your guidance, they would be willing to consider communication around how that should be handled by providers. A lot of the frontline providers are family medicine, internal medicine, PCP doctors who, quite frankly, this is not their area of expertise, and they are really bearing the brunt of this work. So it would be helpful to get standardized understanding and even some communications, and it would be really positive to see us lead the front in disseminating that as to when should you consider testing for a vaccine, so that we're not overwhelming the state who already have limited resources with those send out tests, but also so we can advocate for our state and making sure that we understand what is happening, because the numbers are so reassuring. I would hate for us to lose ground because of a limited understanding.
Right, and that's one of the things that we've been really adamant about, is really focusing on prevention as well. So, we interrupt the chain of transmission, then we can reduce the potential for new variants being created or detected. And so we are still focusing on prevention, so making sure we encourage individuals to wear face covering, social distancing, all those measures that we've been talking about since day one of this pandemic. We'll need to continue, at least for the foreseeable future, until we have more data and more scientific evidence that other measures may be appropriate from the CDC and our other national partners.
Thank you, Dr. Eccles. I have another question. Is the data for on vulnerable communities and vulnerable individuals in the community, in terms of who's been vaccinated, is that readily available and easy to analyze so that we can actually measure the distribution of the equitable distribution of the vaccine in those communities? So can we confirm that with data, or is that in progress?
So that's in progress, but what I will say is that it was really alarming for me when I looked at the data, when I looked at the database. So when we queried the completed and submitted registrations by zip code, of the over 70,000 applications that have been completed and submitted now, a little over 2,000 were from North City, and we had queried all the zip codes in North City. And so that means that, that the digital divide is very real, but we also need to make sure that individuals have access to individuals or resources that can help them register. And so the health department, we've been helping lift that work as well. So we are allowing individuals, our staff, to actually register people over the phone. If they call the COVID-19 hotline, the 314-657-1499 number, they can register individuals over the phone. We're also working with some of our other partners to get individuals registered who may not have access to IT resources. And so that's something that we really have to be mindful of. And we have to really look at the data from that lens as well, because if you just look at the data and say, oh, well, let's say 1,000 people or so in North City have been vaccinated, is that a reflection of our efforts to actually engage that community? Or are we just taking the number based off of who's been vaccinated? So I think we have to do a better job of going out and engaging that community and making sure we're accessible and connecting them to resources to register, but also giving them access to the vaccine. So there's a lot of work that has to be done, but that work is in progress.
Thank you. So would will there be reporting by race and zip code? I know that it can't be such that you can identify individuals in small areas, but when do you think we would get reporting on specific communities that are at risk?
And we'll try to have an aggregate report for zip code and race level data for our next board meeting.
Thank you. Any other questions?
Yes, just real quick. Dr. McBride put a comment in the chat about the segment on CNN about Delwood, and actually several people that I know saw the segment, and I saw it. I actually disagree. I don't think it was very good coverage in terms of how the person was communicating or making suggestions or recommendations about which vaccine a person should take. So for those of you who didn't see it, yesterday evening, CNN had a segment about a pharmacy in Delwood who had access to, I think, at least 2 different vaccines, and the pharmacist there was, their offer to patients was, do you want 1 shot or 2 shots? And not really explaining the differences between between the different vaccines that she had available. And most of the people, I think the report said 2/3 of people there took the Johnson and Johnson because it was just 1 shot.
Yeah, I agree, Kiana. It seemed, at least by the report, it seemed like she was giving them just the information of, do you want 1 shot or 2 shots, without fuller information about the efficacy of the vaccines. You know, it's hard to tell from a story, but it's good to see people get vaccinations. I agree with that, but.
And I have just one last question. It was actually from several community members that I've interacted with in the past week on the homeless and unhoused and transient community, and what are the plans for that community. And excuse me, I have they're repairing the roof, and so I apologize for the hammering in the background. So is there a particular plan for those that are unhoused or housing insecure for vaccine delivery?
Yes, so we've already worked with the housing service providers, and so we've allowed them to receive the vaccine through our mass vaccination clinics, and we opened it up to their staff who were interested or desired to receive the vaccine. We're planning for the unhoused population, but we'll be working closely with the Department of Human Services to make sure that we have connection with the right individuals within those agencies, and also want to make sure that we are providing as much education information to those individuals beforehand, so that they can be empowered to make decisions for their health as well. And so right now, the unhoused individuals who meet the current eligibility criteria, so if they're 65 and older or they have qualifying underlying medical conditions, they can receive the vaccine now. But the others, I think the state, according to the state's plan, they become eligible to receive the vaccine in phase 2. And so we'll be working closely with the homeless service providers and the Department of Human Services to make sure that that population is taken care of as well.
Thank you. Any last questions about COVID vaccine testing? Thank you. So we'll move to the next agenda item, which is a student presentation with Dr. Eccles and a student intern.
So one of the things we want to highlight is the work that we're doing with the academic institutions. So as an academic health department, providing quality public health experiences for public health professionals that are in the pipeline. It's important for us to be able to highlight the great work that they're doing for the health department as well. And so we have one WashU student who's been working closely with our epidemiologist, Matt Haslam, on their capstone project. And so this is going to be a short presentation of that individual's capstone project. So now I'll turn it over to Matt Haslam to introduce the student.
Yes, good morning. It's my pleasure to introduce Michaela Brands, who is a dual MSW MPH student at the Brown School at Washington University. And so she did her practicum with the Department of Health, in particular the environmental health section of the DOH. And I'll turn it over to her to talk about her project titled Exposure to Vacant Buildings Demolitions and Elevated Blood Lead Levels in Children Under 6 in St. Louis City.
Good morning, everybody. Can you all see my screen?
Yes.
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 Okay, great. Well, thank you so much for having me here today. I'm excited to share some of this research with you all. So to give you a little bit of background about the issue, we know that vacancy is harmful to physical and mental health, and that St. Louis has some of the highest vacancy rates in the country. And we also know that one of the strategies that St. Louis has been using at an increasing rate is demolition of these vacant buildings. It hit a high last year with 659 publicly funded demolitions, and it was down a little bit in 2020, probably because of COVID and funding, but overall it's been going up a lot. Research over the last 20 years or so has shown that demolition releases lead into the surrounding area, which can increase the lead dust fall in the area right around the demolition by about 5 to 40 times. And that lead can actually spread up to 400 feet into the surrounding area. So the area that can be impacted by a demolition is actually even bigger than the Superdome. We also, as you all know, lead is dangerous to children. It is bad for growth and development, and it can actually impact the health of individuals over the lifespan. And the good news is that lead spread from demolitions is preventable. Other cities have done a great job of implementing policies through a combination of community notifications, water hoses, and other methods. So St. Louis's Demolition and Public Health Task Force is going to be making some recommendations about policy changes pretty soon. So just keep an eye out for that. And it's not just that lead spreads into the area around demolitions, it's that then it actually gets into kids' bodies. So the first research on this was actually done in St. Louis in 2000 using 2002 data. And the researchers found that exposure to multiple demolitions on a block where a kid lived was associated with elevated lead levels in those kids. And then more recently, they found similar results in Detroit, although it was a little bit mixed in more recent years, and they attributed that lack of association more recently to preventative policies that they had put in place. So what about St. Louis today? Are the demolitions that are happening at an increasing rate leading to elevated blood lead levels in kids who live nearby? We don't know because we haven't actually studied it for almost 20 years. So that was the purpose of this research, looking at St. Louis from 2017 to 2020. So I used publicly and privately funded demolition data from the building division combined with lead testing data from the Missouri Department of Health and Senior Services. And so using GIS, basically what we did was looked at these demolition sites and then each child who got a lead test and looked at an area with a radius of 400 feet. That's based on the previous research about how far lead spreads, to count up the number of demolitions that they were exposed to. But it's not just the distance that matters to these exposures, it's also the time period, because lead can accumulate in children's bodies and then on the ground, but then it also dissipates from the ground. So the exposure used in this study was the number of demolitions within 400 feet and 33 days of the lead test that the kid got. And then the outcome was elevated blood lead levels, so 5 micrograms per deciliter, which is the CDC cutoff point. But the problem is that St. Louis City actually only started collecting the actual date of demolition in January of 2021. So I had to estimate the demolition dates from a combination of permit and inspection dates. So here are the results of the study. This map on the left, that's kind of black and white and gray, shows that the darker gray areas are areas with more demolitions, and then the cross-hatched areas are areas that are majority Black. And in fact, that's what the statistics showed, that the majority Black neighborhoods were exposed to significantly more demolitions than if the demolitions had been distributed equally. And then I included for context this map on the right, which is from the Environmental Racism Report at WashU. And the darker red shows the areas where kids had more lead poisoning. And again, the crosshatch is areas that are majority Black. So you can really see the overlap. And there are huge racial disparities in lead poisoning in St. Louis. In 2018, 3.25% of Black kids had elevated blood lead levels compared to 1.11% of white children. And as you know, it's not that Black children are somehow biologically different than white kids. It's that racist policies have led to segregation of Black families in areas of concentrated poverty with poor quality housing. So then to answer the sort of main research question about whether demolition was associated with elevated blood lead levels. The study found no significant association. And so that could be good for kids in St. Louis. And it could also mean that factors like lead paint and housing and soil play a much more major role than demolitions. But I would really caution you against making that conclusion because of the limited data, because the statistics were based on estimated demolition dates. So some potential next steps that the city could think about doing would be to repeat this study, but now that the building division is collecting actual demolition dates, then the validity of the study would be much better. So to do something similar, but with more solid data to really see if there's an association. It could also be possible to implement soil and air monitoring near demolition sites to check on the lead being released, as well as the particulate matter, which is, leads to asthma. And then to systematically identify and test children near demolition sites. This could also provide an educational opportunity for families around lead safety. And then finally, to implement and enforce better protective measures. For example, this picture on the right is a misting fan, and that is required but not always enforced right now. So until we are able to actually accurately measure the impact of these demolitions on blood lead levels, it's really important to enforce protective measures, especially to avoid creating additional harm to Black children who are already at disproportionately high risk for elevated blood lead levels. So thank you so much for listening, and I'm happy to answer any questions or talk with anybody more about this later.
Thank you so much, Michaela, for your work with the health department. And congratulations on your 2021 spring graduation. Do we have any questions from the board or our panelists or participants?
Michaela, that was outstanding. Congratulations on that work. And so part of the issue, and you recognize this, is that we don't have a really strong grasp on the prevalence region-wide of lead exposure in these kids. And so that's one of the confounders. We don't know what the baseline is. And so I'm curious, maybe whether you're involved in this project going forward, it would be nice to do do some serological testing in one region, just testing lead rates in these kids, and then that is less like that has a similar demolition plan, and then compare that to a region which historical legacy region of North St. Louis, when the kids have prior lead testing. Is that feasible? Is that study feasible, you think?
I would turn that over to Matt or Dr. Eccles, who would probably know more about that.
Dr. Ross, you're suggesting comparing St. Louis data to other regions, or
just comparing St. Louis data, one area that is distinct from North St. Louis or North County, so that we can actually do some matching, or even a more complicated propensity matching. I don't think that's necessary, but just looking locally, so we can understand prevalence before and after demolition.
Definitely, yeah. So part of the problem is missing data. So not every child who should be getting screened for lead testing is tested. The testing rates in St. Louis are, correct me if I'm wrong, Michaela, around 50% of
yeah,
kids.
about 45 or 46, I think.
Mm-hmm. So we're missing quite a bit of data on just who's being tested in general. The other issue for demolitions, as Michaela noted, most of the demolitions are occurring in North City. So getting a comparative group might be challenging. And we did look at kids who were exposed to multiple demolitions, but were not elevated in blood lead levels. And so we did some sensitivity analysis there. But it is a great point, comparing, a similar population to the North St. Louis one. It's just trying to find a good comparator group, which would be challenging.
But I appreciate what you just stated, and what Michaela supported was that our rates of lead testing is far too low. And again, we would need to know that so we can get a sense of the overall impact of the demolition and lead exposure, lead dissemination. So, that's work to be done. Thanks. That was great though.
Any other questions? I see that there is a question in the chat from Cyril Loom. Will the presentation, could it be sent to the board and made available to us?
Yes.
Wonderful, thank you. Again, outstanding presentation and important work. And it seems like it's a great start to the city moving forward and figuring out how to protect our kids from lead poisoning and other contaminants from demolition and building demolition. So any other questions? Otherwise, we'll move on to the next agenda item. Okay, so we will move to new business and we'll have several updates from the health department staff.
So as I've mentioned, I guess time and time again, that COVID-19 is only one thing that the health department is tackling, but we can't lose sight of the other essential functions, the core functions of the health department. And so the first presentation will be from Ms. Franda Thomas, Health Service Manager 2 with the Health Department, on end of the HIV epidemic funding that the health department will be receiving through the state of, through the Department of Health and Senior Services. So I'll turn it over to Franda Thomas at this time.
Good morning, everyone. So as Dr. Eccles just mentioned, we did receive ending the epidemic funding. The ending the epidemic funding is intended to build on the ongoing activities we currently conduct through our HIV prevention program. The goal of the ending the epidemic is to reduce HIV infections by 75% in 5 years and by 90% in 10 years. So the key efforts focus on 4 key strategies: diagnosis, treatment, prevention, and our response. So we are tasked with providing the HIV prevention services throughout the St. Louis region. This includes Franklin, Jefferson, Lincoln. Oh, I'm sorry, I was a little ahead of my presentation. Thanks, Kill. Includes throughout St. Louis region, including Franklin, Jefferson, Lincoln, St. Charles, St. Louis City, St. Louis County, and Warren counties. The total award is $576,347 for each year. Our award actually was started November 1st of 2020 and it ends July 31st with 2 renewals. So we're super excited about that. So overall, our deliverables and outcomes are to increase routine opt-out HIV screenings, increase the local availability of and accessibility of HIV testing services, to increase HIV screening and rescreening among persons at elevated risk for HIV, increase rapid linkage to HIV medical care, increase early initiation of ART, increase re-engagement to HIV prevention and treatment services, and to increase PrEP and PEP, and lastly, to increase access to comprehensive harm reduction services. That's our update on ending the epidemic.
Because this is a critical project because it helps us leverage funding resources for some of the other projects that we're also doing. So we're funded by the CDC for the community approaches to reducing sexually transmitted infections. We also have other funding that the health department receives through the state for HIV prevention. And so we're covering the region with those funds. So this will help enhance our ability to reduce the spread of sexually transmitted infections, including HIV. One other critical program that we have in the city of St. Louis is the Brian White Part A program, which is critical for providing essential medical and core support services for individuals living with HIV. And so that's our next update, which will be provided by Ms. Tanya Madden.
Good morning. Thank you, Dr. Eccles. So I am happy to announce that we have been funded yet another year, which is our, I think the city of St. Louis has had this grant for, this is going on 28 years. We're funded, we received our partial award a couple of weeks ago for $1.4 million, and we expected to receive up to $6.5 million coming in April. So we have a great relationship with HRSA. We meet with our program officer monthly to provide updates and communicate all of the challenges and successes within the program. And we also have a plethora of sub-recipients that we connect to and contract with different services that we provide within the program for our most vulnerable population. We are moving into a a dynamic that we're going to be meeting with our subrecipients according to service categories instead of having all of our subrecipients together, so that we can just kind of engage and really get to know what service needs within the program are, unmet needs, challenges within each service category. And I think our subrecipients are very open to that. And as well, we also meet, when we meet with our program officer each month, that is a discussion with also our fiscal department and also our planning council. We give updates on all parts of the program. So we're very excited to be moving into a new year. We're creating new dynamics within the Department of Health, and our team is a great team, and we're just happy to be a part of the program.
And one thing to highlight about the Ron White Part A program is that, again, at the start of my tenure, there were compliance issues. And so we've worked really hard over the last 2 years to not only build relationships with HRSA, but also to revamp the program. So right now we have a compliant federal program that receives roughly at least $6.3 to $6.5 million annually to provide critical services for some of our most vulnerable individuals in the city of St. Louis. But just receiving the funding isn't sufficient. And so one of the things that we're doing internally within the health department is making sure that each program is aware of services provided by other programs. So that way, if there's overlap, we can leverage resources as best as possible to make sure our programs are efficient, not only efficient, but also data-driven and working to meet the true needs of our community. And so Franda Thomas, Tanya Madden, and the other DOH staff are doing an amazing job of just sharing information so that other programs are aware of what's happening, but also leveraging resources to make sure that we're as efficient as possible and working to meet the needs of our community. So thank you all for those updates.
Thank you, Department of Health staff. Excellent work. And thank you for holding up all the other programs, as well as supporting the department's work on COVID-19. Do we have any questions about any of the HIV programs or any other work that's been presented?
Quick question, Madam Chair. I think Franda can answer this about whether we have any, whether we've enhanced our targeted funding to the MSM population.
Oh, absolutely. I'm sorry, what was the last piece?
Just in St. Louis, in the region.
Yeah, absolutely. As Dr. Eccles spoke about earlier, we have our CARS program. And so with the CARS initiative, that is actually our focus, African-American MSM 18 to 29 in the St. Louis region specifically. So that initiative is going off to a wonderful start. And those efforts are targeted specifically to that target population. And we have working with the fantastic subcontractor, Williams & Associates, who are the best at reaching that population of interest and building and establishing our community advisory boards throughout the city. So that's happening now.
Great, thanks.
Dr. Ross, I just want to add as well with the Ron White program that we also contract with Williams & Associates. So it's an overlapping consideration for everyone.
Wonderful, Tanya.
I just wanted to say thank you to Franda and to Tanya for your leadership. They're very humble, so I'd just like to add a few things about the work that they do. Not only are they seen as leaders in our region, but they do such a fantastic job of like building and developing and maintaining relationships across the aisle. And so you all think I just like to jump on TV and talk about COVID, but my background is actually with people living with HIV. That's really what probably got me here. And Franda, is the co-chair of Fast Track Cities, is really a leader and has brought community partners to the table, created a model that is now being, I think, going to be replicated multiple times over. I was talking to a state senator that wanted to do the same because, under her leadership, we've brought together all the main community partners, the county, and our academic partners as well. So I just want to say that the work that Franda and Tanya has done is really going to put St. Louis as one of the key cities in the nation to really get to the goal of ending the HIV epidemic with that 2030 goal. And I just want to thank you for your leadership, but for creating a blueprint that I think can continue for such a long time. So thank you so much, both of you.
Thank you, Dr. Mahdi.
Thank you very much.
if I could just jump in, and Dr. Mahdi, please don't ever stop talking because we really appreciate your voice everywhere. So
You may be the only one. Some people be like, stop talking. You know, maybe my husband, but we'll save that.
no, I'm a big fan. So just on the, I echo the applause for Rhonda and Tanya. So just something to add on to this, Dr. Ballou, I know our agendas are really chock full with COVID and vaccines and all this, but as Dr. Eccles said, there's a lot the board does. And just cycling back on this at some point would be a good thing. And just sort of, and a topic that would be interesting to hear about is just sort of some outcomes from this work and sort of where we're headed on these epidemics, HIV and other epidemics, and just sort of a question we've been pondering about, I think at WashU and other places, is sort of what's the impact of the COVID epidemic on these trends? As people are staying at home more, how is that impacting the other epidemics we have? It's just a question I ponder about. You can think about it going in a couple different directions. So, but we had one epidemic going on with HIV that hopefully is going in the right direction, and now we had another one layered on that's much worse. And so, a question that would be interesting, like to hear a presentation on once things calm down, if it ever does, is how those trends are merging or co-merging, or so. I'd love to hear that.
Tim, thank you for that. So those presentations are actually in queue. So we have everything going from substance use disorder and the impact of COVID, HIV, STIs, and other issues. So those will be coming up during subsequent board meetings. The epidemiologists are already working on. We've been having those discussions for the last couple of months. So.
I would like to shout out though, Dr. McBride, if you haven't already seen it, one of the things that's happened under Tanya's and my leadership at Fast Track Cities is there is now an HIV dashboard that you can access on the city's website. And so, my good friend, Dr. Corey Bradley, always says data is justice. And so that we thought that under Dr. Eccles' leadership, bringing together epidemiologic resources with a budget of $0. I'd like to say we have this very first, can I get an amen for a budget of $0? The state's very first HIV dashboard. So that's regional and statewide data that can inform policy and some exciting things that we can then come out of that. So I just wanted to highlight that that's available, and a lot of subsequent projects will come out of that. We're actually now launching the first regional HIV Rapid Start program to get people started on medications. So a lot of great work in the pipeline.
Thank you all. And I will amen the budget of $0, but I'm not amening it for that reason. I'm going to amen it so it doesn't stay at $0, that all the work you've done to show that you've gotten, that you were able to do a tremendous amount of work with no budget is phenomenal. So again, Tanya and Franda, thank you for all of your work. And we hope that that your work is seen, and anything that we can do to make sure that your work is seen. And thank you for posting the Fast Track Cities HIV data. So if anybody's interested, everybody should look, it's in the chat, and let's advocate so that that budget doesn't remain at $0. And again, I would just like to say that, the city's been pushing through the COVID pandemic and trying to keep the city safe from COVID. But at the same time, we can't ignore all of the HIV epidemic and STI and gun violence and all the other issues St. Louis has had, because we don't want to get left behind or not address those other issues. So really the staff at the health department have been working double, triple time to maintain, to continue to make progress on all of the health issues that were already present in the city, and then have to respond to COVID on top of that. So I really commend you on this work and maintaining that balance. So yes, amen to more money, amen to what you've done with no money, but amen to getting some money in there and getting some funding. So do we have any more questions? Okay, so we will move to the next agenda item. So we are on to board committee reports. So we will start with Governance and Nominating Committee, please.
Good morning. Thanks, Rhonda. I think there's really not too much new with our committee. We have heard from the mayor's office that she's reaching out to our new board members who need to be sworn in. So obviously, since we had handled this in the past by someone from the mayor's office came over in person to our in-person board meetings and was able to swear everybody in at once. By now, I'm hoping that the new board members have heard from the mayor's office and know where they need to go to be sworn in. So if there are any questions or concerns about that, people can reach out to me or maybe to you, Rhonda, and you can send them to me, whatever would be easiest. The other issue I've had in my mind, Rhonda, and this is not necessarily a committee update, but since we've had more frequent board meetings, we haven't really had the opportunity to have committee meetings. And so we haven't really turned our attention to our specific committee work. And I don't know if other committees are having that experience, but I guess I'd like to get your feeling as the chair, how you would like us, do you want us to sort of press ahead with our committee business? So we can do it virtually, or I guess really our only option is to do it virtually. So one question is, would you like us to continue ahead with our committee work and fit it in regardless? And the second question is, I'd like us to create some kind of a formal mechanism where we could actually solicit our new board members for committee assignments. I think we had talked about perhaps doing another board orientation session. We had that one excellent orientation session that Dr. Eccles had done, providing our board with an overview of the department and its work. But I think there is more information that we could provide about our board itself and its responsibilities under the charter and under the bylaws, each committee's responsibilities, so that new board members could make a more informed decision about where they would like to devote their energies. We've touched on all these issues previously in our meetings, but a lot of these issues have just sort of been kind of hanging out there. And I guess this is sort of a mea culpa in some ways, like we just really haven't met, we haven't done anything about it. And so I'm just wondering if other committees are sort of in the same boat, and what you'd like to see as the chair, or maybe some other committees would like to weigh in. And I'm going to answer these questions, and then I have been reminded that we've perhaps skipped over an agenda item for the FY22 budget. So I will answer these questions. We'll go back to the FY22 budget, and then we'll finish with the committee report. So as also I was advised by Dr. Ross, after the March 18th meeting, we will go to monthly. Everybody's been working extremely hard, and we will go to monthly meetings after our next biweekly meeting, so that we can have an opportunity for the committees to meet in the 1 month intervals. And yes, we will be doing a subsequent board training. So I will work with Dr. Eccles and Dr. Ross and McBride to come up with the subsequent board training where we can address all those issues. So and in response to your other comment on should we can forge ahead with the committee meetings, so I mean there are different levels of urgency for different committees. So I know we're going to have an update from the communications committee, and given the communication needed from
in regards to COVID, they've had to really push forward and have committee meetings out of just necessity because of the urgency of communication during the pandemic, and especially about vaccine distribution and equitable vaccine distribution. So yes, we will have a board meeting. We will change the frequency of board meetings so that we can, obviously we will have a board training, and we will hear about that in the next couple of weeks, but I will speak with Dr. Eccles about that. And we will have a change in frequency of board meetings so that you can meet in between.
Okay, thank you. Thank you very much. That'd be really
Sure, sure. And so I want to make sure we get back to the FY22 budget. So that, because that's extremely important in order for the health department to do any of its work.
Okay. Well, thanks for reading chats, responding to questions, and keeping the agenda moving all at once, Rhonda. I appreciate it.
Thank you. All right, Dr. Eccles, is that you, FY22 budget?
Yes, so I'll be brief in the interest of time. So the health department, one of the things that we also prioritized at the start of my tenure is having an inclusive process where the managers within the health department are also included in the development of the budget for the upcoming fiscal year. And so the fiscal department, led by Mr. Emmanuel Knie, has worked really diligently over the last few months to work with the management, particularly the executive leadership, as well as managers across the health department to make sure our FY22 budget requests are reflect the true needs of the department. And so yesterday we had our budget hearing or budget meeting with the budget office budget division for the city of St. Louis. And so things are moving in the right direction. We are really grateful for how the fiscal restructuring that has occurred within the health department to make us more efficient and more fiscally responsible with the implementation of new, more effective and efficient internal controls. And so after we receive feedback from the budget division, we will relay that information to the board, probably in a separate meeting, to make sure you all are aware of what the FY22 budget and allocation will be for the City of St. Louis Department of Health.
Thank you, Dr. Eccles. Is there anything that we can do as board members, private citizens or otherwise, to make sure that the city gets an adequate budget and that you are not underfunded and are able to continue to do your work and to do your work without zero funding in some areas? So is there anything that we can do to advocate, and what assistance do you need in that matter?
So I think one of the things, so when you say zero funding for some budget, some of the initiatives that the health department we're forging ahead with are new. And so there weren't line items in the budget. So one of the things that I've had to do is be really flexible with the director's office budget to make sure there's funding or resources in place for these new projects. And so as these projects move forward, what we're going to do is make sure that there's an allocation for our upcoming fiscal year, or even secure additional grant funding to support the critical work that we're doing and that needs to be done for our residents. And so we are very intentional about our efforts, and so we don't want just a lack of the perception of the lack of fiscal resources to stop any of the work that we're doing. That means I can't travel and I can't do or attend conferences, then I have to support my staff. So as a director of health, my primary responsibility is for supporting my staff and the programs that we are implementing to ensure that we're meeting the true needs of the community. And so we've been doing that since day one, since I started. And so that will continue. However, we don't want that to be the only option. We are very adamant and very active in seeking new funding opportunities to support this critical work as well. And so the biggest thing that the health department can ask for is just effective advocacy. But we want to make sure individuals who are advocating on behalf of the health department are well informed and understand the true needs of our department. And so what we'll do is during a subsequent meeting, I'll give you all details of our FY22 budget, and so that you all can effectively advocate on our behalf.
Thank you, Dr. Eccles. And I would like to say that the health department staff are extremely busy in writing grants and trying to procure funding from various sources, and have recently sent out a grant for review to several community partners and academic partners from the that's to go to the Kellogg Foundation. So I do want to commend you on pushing very hard to try to procure grant money and money through other sources. In addition,
I couldn't agree more. And in supporting agencies and collaboratives that have not been supported with resources. I mean, you know, to think about coming together with the dashboard where no one else would come to the table to provide us an entire epidemiologic team, every available resource, I mean, is unprecedented. And I know if he's doing that for Fast Track Cities, you know, the City of St. Louis Health Department is doing this for so many other community partners who also lack this type of support. So it really is exceptional, but you're absolutely right. The work of the health department does need to be, you know, supported more so that they continue to do these critical measures for our communities.
thank you, Dr. Mahdi. Any other questions or comments about the FY22 budget? And we'll be hearing more at subsequent board meetings.
This is Emmanuel Kenny. I just wanted to add to what Dr. Echols has said that we have requested for some additional positions in different areas of the department. So we'll see if those positions are approved, but if not, that is one of the areas I think that the Board of Health could be able to assist us to make sure that we have positions that we are requesting for in different areas of performance of the department, to make sure we have those human resources that will be able to respond and to attend to the needs that we have in the community. So we just wait and see if the positions will all be approved.
Thank you.
I guess I have a quick question or comment. I'm more aware of what's going on at the state right now because I've been working on Medicaid expansion, as you know, and the sentence I'm now about to say, I don't think I've ever said in 30 years. The state seems to be flush with money. We started the year with $1 billion in the bank, and you know, the amount of money that's flowing in because of increased FMAP funding. And if the Senate passes the bill that it appears that they are going to be passing in the next few days, there will be more money flowing to states and localities for COVID and other things. So I'm pretty aware of what dollars might be flowing to states if that's the case. And again, I'm blown away sort of about how much money might be flowing to states. And it's all appropriate in my mind because of, we are all aware of how beleaguered states and local governments have been. And we've heard a lot about it in these meetings. And Dr. Echols and Mayor Cruzen have lived this. And with the recession and COVID and triple threats of social justice as well. So I guess my question is, if all that happens, do we have an opportunity to sort of more fully fund public health and other social justice needs?
So one of the things that's out of our control is how the state allocates funding. And so we know that we can advocate, but we don't have any control over the decisions that they make. And so so one of the things that I'm charged to do is to make sure that I'm being fiscally responsible and championing public health for this department, and in some cases for the region. And so those efforts will continue. We'll continue. I know that there's ongoing discussions at the state level for a variety of different issues, but we can't control how they allocate funding. What we can do is advocate for additional resources to come to our jurisdiction.
I think what I'm picking up from Dr. McBride's question is sometimes having a plan or a proposal that's ready or being able to express a specific need facilitates the state in making a specific investment. And I believe it in one of our meetings, we talked about having maybe a statewide association of health departments or some other group that kind of interfaces with the state. But I think it makes sense to be thinking now about what types of requests we would have
and then what relationships we have that can put those requests in front of the right people, because they are going to have to allocate, and they traditionally allocate to known partners. So.
Yes, and that's a great point. So the Missouri Centers for Public Health Excellence, which is a coalition of public health agencies across the state, have been in ongoing dialogue with the state around a variety of issues. And this is something I can bring up to that group as we meet weekly. Thank you for that.
Thank you. And if there's any way, if we can get any kind of advocacy or any other report or information at board meetings, so that we know as board members and as citizens that what we can do in terms of contacting our local officials and our representatives to assist in advocating, that would be helpful. Any additional comments or questions about the FY22 budget? Okay, so we will get back to board reports with the Academic Collaborations Committee, and then to follow with the Communications Committee. Any updates, Craig?
I do not have any additional updates, Madam President. As you know, there was a presentation at the last meeting, and we continue to meet. We are working on how we can better establish some of the programming with regard to the interns for a more robust program that's better acknowledged and better put into writing. There have been a couple of great presentations and trainings recently from St. Louis University as well. And those were from other colleges, which of course is what we're trying to do, is to expand this beyond just public health. Of course, public health has a lot to offer, but there are other disciplines with whom we can learn so much. So that is the update for now.
Great, thank you. And I know that the speakers from the last board meeting also wanted to note, especially to support health department staff, that there is an ambassadors program. So if you could spread the word to the staff, and also we'll send some information out that there's an ambassador students on a short-term basis for 4 to 6 weeks for 5 hours per week to work on a specific project. They will identify a student to help provide some additional expertise and person power to assist. So, and hopefully that could be helpful to the health department staff when you need some extra hands or some different expertise or analytic skills. So that is available. And I'll make one last comment before we move to the Communication Committee's report. For those that need to be sworn in for new board members, it's not just new board members, it's also board members that have been reappointed. So if you've been on the board for a while and your appointment expired and you're reappointed, you also need to be sworn in again. And you should have, somebody from the mayor's office, likely Ms. Dion has probably reached out to you. So anybody who's been reappointed or newly appointed needs to make an appointment or arrange a time to go down to the mayor's office to be sworn in. Communications Committee, please.
Thank you. We met on Monday for an hour, 9 to 10. Our two new members are Dr. Mahdi, AKA Mahdi, and Serena Muhammad, who both have great networks and relationships, who are helping us plan and execute the following things. First, we're doing at least a year-long effort in continuing to prioritize stakeholders and planning how to enhance communications with all people who live in the city, all our different St. Louis City populations. Our goal is to provide them with more information and assistance, vaccinations, information about vaccinations on COVID-19, of course, is our first priority, but also our public health issues that Dr. Blue mentioned, HIV, AIDS, maternal and child health, gun violence, et cetera, all lead, anti-lead, et cetera. To Dr. Blue's point, we're gonna hire a communications intern. First, we're gonna look for one, write a job description, but to help us on a 4 to 6 week base as someone who's really adept in social media, but to the point of we need to reach all parts of our city with vaccination information, and then how to, you know, sign up to get vaccinated, and then how to get to the sites or how to receive the vaccination. We know that social media is really, really, really important. And we also know that the younger generation, which is more hooked into a lot of social media, are in many cases the caretakers for older family members who we desperately need to get vaccinated. So this is priority one, to get that job description out, and starting with SLU ambassador program, see if we can get someone in there for that, for a trial basis, to work with me, the committee, and our staff, Harold and Kim, public information staff. Then finally, as breaking news, Rhonda's been in touch with Better Family Life to help us tackle our, helping our vulnerable populations get vaccinated on the north side. And Better Family Life volunteers are going to do door-to-door pamphlet drops to reach vulnerable populations in low-income neighborhoods that are not digitally connected, or who may not even have phones, or certainly don't understand the protocol and processes to sign up, which are confusing to some people. So we'll do some door-to-door outreach through our connection to that organization. We are also, with our elasticity marketing firm, printing materials to distribute door-to-door with the website address and telephone contact numbers for people to reach, to call for information about the vaccination and registration. We have a whole 2-page worksheet of tasks that our committee are going to help with, and we will hook the rest of you on this call in to help us as the year unrolls, as we need to work with you with your knowledge and your relationships with community organizations. One really new thing that we haven't talked about before that Cyril brought up was reaching our immigrant populations and all the languages that we need to communicate in, and how, and what resources, which Serena told us the state will offer us free translation services to get our messages to the 5 major languages beyond Spanish after English that we need to reach people with here in St. Louis City with our health messages. So we're off to a good start. Appreciate everybody's work. No, it's not my paid job either, but this is the most important thing that I personally am doing right now. So I'm really happy to work with staff and the committee and all of you, and see what we can get done in terms of reaching people further with our messaging and having dialogues with them.
Thank you so much for all of your work, the whole committee. I mean, that's
welcome. The committee's great.
Thank you. There are, and I know Cyril also has some relationships over in this area. There's a particularly vulnerable community of immigrants and refugees in the Hodiamont area, public housing, that there are some groups that do go door to door and do some work with that community in particular, that could be of assistance. So please let us know and reach out to the rest of the board, because there's some of us that have connections and do some work specifically in refugee committee if we need to take the same approach as with Better Family Life to go door to door. There's capacity and interest in doing that with some organizations that work specifically with those immigrant and refugee communities. So please reach out to us and let us know. But thank you for all of your work. It's really outstanding and greatly appreciated. Any questions or comments about any of the board reports or updates? Okay, next is department updates. Dr. Eccles.
Yes, we have one update from the Environmental Health Department. A few meetings ago, Janine Araghi and I believe Craig Smith provided a presentation on the food safety legislation, and so for the food code rather, for the city of St. Louis. And so I want to have them give a brief update on where we are with that. So I turn it over to Janine.
Good morning. Yeah, we were happy to learn this week that the mayor signed the food code sometime last month. And so we anticipate that based on the way the code was written, it will go into effect on or about May 24th of this year. So as we reported on, there are a few changes. One of the exciting things that we're working with some teams of folks across the city is on reusable food containers to help cut down on plastic pollution in our environment. And so I think the county is also kind of interested in maybe engaging with that project as well. So I'm excited about, we'll be putting together some new brochures and doing some outreach to our food establishments to make sure they have a good understanding of the new code requirements. Thank you.
Great, thanks, Janine. And along the lines of food safety and food access and food equity, the health department was also has a funding opportunity with this state. And so Candace De Silva is going to give a short update on the Food RX program.
Thank you, Director, and good morning to everyone. So some more great news. We have applied for some carryover funding for the Food RX project at the request of the Department of Health and Senior Services. And so we will be approved for $6,000 for transit ads. And so these are ads at Metrolink stops and at bus stops. And essentially, we have done this in the past with our Food RX program, but what we're doing to improve these transit ads is also include not just the link market schedule and stops, where folks can be engaged and sign up for LCPs and receive nutritious food, but we are also including actionable steps as to how they can sign up for those lifestyle change programs per the CDC best practices. We also have some carryover funding to promote and develop a website on our Think Health STL platform that will specifically cover the Alliance partnership. As a reminder to the board, the Alliance, so this is just not Food RX spearheaded by the Department of Health, but it is part of a larger chronic disease prevention approach throughout the region. The Alliance partnership consists of the Integrated Health Network, our county public health partners, federally qualified health centers, and other entities addressing food insecurity like the Metro Market. So they are all convened stakeholders in this approach. And the goal of this project overall is to connect individuals who are living in the trauma zone zip codes and who are at high risk for hypertension and diabetes with nutritious food and enrollment into lifestyle change programs so that they can be empowered to control these chronic disease conditions. So there'll be an additional $10,000 supporting that collaborative website development and maintenance work. And there's some elements that we've even discussed for that website, specifically testimonials from participants in our LCP programs, again, highlighting where participants can continue to access nutritious food throughout the program. So Food RX offers a $50 nutritious food bundle just for speaking to us and completing a form for enrollment, even if the party does not enroll. And we think that this continues to help break down some of the barriers so that we can get more folks into the program. But it'll also have briefs from our epidemiologists specific to hypertension and diabetes. And there is also discussion with our public information officers to include a specific Food RX webpage housed on our DOH website to continue to raise awareness about the program. So we're really excited to have additional funds coming into our contract that is about, for the Department of Health, $124,000. And that just means that we can continue to connect folks who are facing food insecurity, and that has been greatly exacerbated during pandemic times, and connecting them to those resources. I would also like to take an opportunity here to thank our director for continuing to support this project, and for Franda's leadership as well, because she's also been discussing ways that will deepen collaboration between the WACA Bureau, that's Women, Children, and Adolescent Health, and CD. There's a lot of intersectionality in programs, and we do serve many of the same folks. And so there will be an opportunity to increase bi-directional referral across those bureaus, and we're really excited about that. So thank you, and I'm more than happy to answer any questions specific to this carryover funding.
Thank you. That is wonderful news to hear. Is, you know, food insecurity kind of underlies a lot of health problems in our community, even in terms of being robust and healthy to be able to you know, manage COVID and some of the other health conditions we deal with. Do we have any, and thank you for your work on that, Candace and Franda. Do we have any questions about any of the department updates?
I just have a question. You called it carryover. What's the length of time that you have for that extension for that program?
Sure, thank you. And that is a great question. So the current contract, all funds need to be expended by September 29, 2021. And so those carryover funds will be spent by that deadline. We have a meeting right after this call to work on website development. And so we're really committed to utilizing those funds. And I feel very confident that we will spend all of our carryover funding down. So yeah, so it's aligned with the current grant period.
Thank you. Any other questions?
I don't have a question, but I'm seeing behind Candace the Think Health conceptual framework, and you know, your reference to that regarding obviously the food safety, and you know, it's just an issue of also communication strategy. I had an opportunity to talk. I was talking to some individuals at Institute for Public Health about Think Health, and so many of them were, even though we had talked about it before, were unaware. And I think that we've lost some, not relevance, but we've lost some excitement and understanding about Think Health and the impact that is having, since that was obviously in the midst of a pandemic. And so I think there's an opportunity then to do a little bit more refreshing on what Think Health is, the fact that it's a region-wide coalition, and the fact that you're now focusing your resources on that one area. So I think we need to kind of firm up our communications about Think Health.
Dr. Ross, thank you for that recommendation, and it is duly noted. What I have been discussing are key performance indicators for these types of websites and development. So I think as the content continues to evolve and improve, certainly we will continue to raise awareness and work with our PIOs to get some more information about Think Health STL. It is a very rich platform, so we certainly want that to be utilized, but also looking at KPIs like the bounce rate, unique visitors to the website. And I think this will also help inform content development moving forward, and that will then better resonate with our target audience. So those are definitely discussions that are being had, and we will take note of that and make sure that we can continue to raise awareness about that platform as a whole.
Thanks, Candace.
And just to add to what Candace says, so the staff that are responsible for the community health assessment and community health improvement plan, a lot of the activity that they were doing with the action team leads kind of fell off because of COVID, but they've resumed those meetings. And so one of the priorities that we'll make sure that they discuss during their upcoming meetings is communication about Think Health STL and the priorities. So we'll make sure that's on their agenda.
All right, thank you all. Any old business? Okay. And last, announcements. Does anybody have any announcements? I have one announcement, just a reminder, and also an invitation that we are continuing to follow up and to work on the health equity initiative that we spoke about the 2 board meetings ago. As Dr. Eccles brought up, there's some healthcare equity issues in terms of the services that some groups receive that need to be addressed in the community, and we created this health equity group, and we are going to start by developing just a set of principles or guiding principles and things we want to accomplish. And so that is actually going to occur and start at 9:30. I'm actually going to propose that everybody get a little coffee break, and we'll start the meeting at 9:45. So please shoot me an email into the text in the chat, or shoot me an email if you want to participate, and we'll go ahead and start at 9:45. Any other questions before we adjourn?
One quick invitation. So this weekend, the health department will be hosting its mass vaccination event. I think some individuals have come through to see the team in action. We would love to have some of the other board members just come through. You don't have to volunteer if you don't have time, but just to come through and see our team in action. If you have time to volunteer, we'd love to have you. We'll find a place for you in our workflow. But we'd love to have you all just come through and see the great work that our staff are doing.
Where will it be again, Dr. Eccles? I can look it up, but I'm sorry.
I'll send an email to the group.
Thank you, sir.
Yeah, I've been to the last couple of events, and they're really organized like a military operation. Dr. Eccles is bringing that military experience. I mean, they are very efficient, and the staff are in there. I mean, you've had staff members that are volunteering their time on a Saturday that sat there for 12 hours, to prep and to get everything ready. So, kudos to the staff that are taking their time and taking their Saturdays or non-work hours to really make it approachable, well organized, make people comfortable when they arrive. So it's really been they've done a really great job. So
yeah, you don't want me putting shots in arms, I'll tell you, but I'd be glad to get enthusiasm going. So
yeah,
you know how frustrated I've been about this whole thing. So
what about prep help beforehand?
Yeah, so we typically do the setup the day before, and then the morning of, we spend our time fine-tuning the workstations and so forth, and then we have a group huddle to make sure everyone's on the same page and everyone understands this historical mission that we're on.
I just had one really critical question about Saturday, and that is, will you or someone else be providing the music for the event, and will there be two-step of some sort at some point, just for data circulating about how that can increase community morale? So I just wanted to know if you had that critical piece of information.
Well, I don't think we can stroll or cha-cha during the vaccination event, but we'll make sure we have some tunes playing in the background for you.
For me, you'd have to play big band, I think so. That's how old I am.
And I think that you may have somehow gotten away without playing Atomic Dog last Saturday, which is I have to commend you on that as well at the Omega Center vaccine event. I don't know how you managed that.
Lots of prayer and supplication, that's what I say.
Yes. Okay, so we are done on time, 1 minute early. So thank you all again for your commitment to these meetings. They've been every other week, and people really put a lot of work into the Board of Health meetings and obviously the staff and to the daily work. So I definitely appreciate that. And our next meeting will be in 2 weeks. So we're still going to keep it every other week until March 18th. And then we will, space the meetings out a little bit more. So if you want to participate in the health equity discussion, shoot me an email and I will forward you the link. Okay, so have a wonderful Thursday, and we hope to see some of you at the event on Saturday to come and support the staff and the community. And maybe come with your playlist, as Dr. Mahdi recommended. We need to come up with a playlist beforehand. Okay. All right. Have a great day, everyone.